Hello, and thanks for joining us on COVID-19 Frontline on CGTN. I'm Jia Yang in Beijing. Now, we are a special live streaming event where we bring together doctors from China and from other countries to share their experiences from the front lines of the pandemic. Now, if you are watching live and you have a question that you want to share with our specialists, then please do go ahead and leave your question for us on our various CGTN platforms. You can leave them on our website, CGTN app, or on Facebook, Twitter, YouTube, and Sina Weibo. Just remember to use the hashtag #MyOpinionOnCovid-19, and we'll try to get to them later in the event. Now, today we're joined by a group of doctors from China who bring their experiences from the front lines in Wuhan during the worst times. And we also have doctors and a specialist from Bosnia and Herzegovina joining us. Now, let me introduce our guests today to you. Now, from China, and all these doctors are from the Qilu Hospital of Shandong University, we have Fei Jianchun, who is the Deputy Director of the Medical Department of the hospital, and he also led this team of medics to Wuhan. Also, we have Cao Yingjuan, Deputy Director of the Nursing Department, Hou Xingguo, Deputy Director of the Endocrinology Department, Wang Hao, Associate Professor, Intensive Care Unit, and Zhang Yi, also Associate Professor, Respiratory and Critical Care Medicine Department. Just a reminder again, as I said earlier, all these doctors were on the front lines in Wuhan, helping out during the worst times of the epidemic in China. And our guests from Bosnia and Herzegovina, we're joined by Ranko Skribic, Dean of the Faculty of Medicine, the University of Banja Luka, Peja Kovacevic, head of the Clinic for Intensive Care for Non-Surgical Branches, the University Clinical Center of Republika Srpska, and also Milka Jandrić, head of the Department of Intensive Care for COVID-19 patients, also at the University Clinical Center of Republika Srpska. And we also have joining us from Beijing, Ivana Todorovic, who holds a master's in public health, the School of Medicine, Tsinghua University. Thank you all so much for joining us on the show. Welcome. Now, just before we begin, a couple of reminders for all our guests. Please do keep your mics on mute when you're not speaking, but of course, when you are saying something, please do turn it on. And I also want to remind our Chinese guests that we do have a Chinese-English interpreter present with us. So if there is anything you want to say in Chinese, then please do go ahead. Just make sure to leave a pause for our interpreter to get in there. Thank you very much. So let's start our discussion. Should we begin with Dr. Skribic? Would you like to start with your question?
Yeah, thank you very much for a nice introduction and for inviting us or giving us opportunity to share some experience and knowledge with you and your colleagues. So best regards from Banja Luka. It's a sunny day here, and the situation at our clinical center and the epidemiological situation is far much better than several weeks before. So the number of cases is declining, and we are all happy that the situation is going to be better and better every day. Special regards and wishes to our student, to Ivana Todorovic, and congratulations from our side that she has finished her master thesis, and we are very glad that someone who is from our university is now finishing the master program at Tsinghua University. So starting from the what you just mentioned about the first question from our side, we listed some 5 questions from our side. So the first one is, if someone could explain us the current experience with the well-known treatment which was proposed at the early beginning from the Wuhan hospital, that you were actually the first using the hydroxychloroquine therapy for COVID-19 patients. So what are your experience, or what were your experience using this well-known old drug for the treatment of those patients, and particularly the clinical efficacy and also some side effects, which will be very important, because for our patients, we actually introduced this therapy in more than 400 cases. So the drug has been used for a while, and actually we did not observe any side effects using the recommended doses. which was in our guidelines, which was actually handed over from your side. Actually, the first guideline we received was from the China, from Wuhan hospital. So the guidelines we have here is modified guidelines from our university, which was proposed for all hospitals in the Republic of Srpska and almost. Oops. Do you read me?
Yes, we can hear you. We can hear you just fine, Dr. Skribic.
Nemoj od vas nigde, moraš biti ovde. Ugaslo se sve.
Mislim da je samo televizor ugasio. Mislim da se samo televizor ugasio. Jer on je još, eto, mislim da to, da.
Just one moment while we try and sort out what's going on over there. Dr. Skribic, can you hear me?
Yeah, here. Sorry, something wrong with technology. So do you read me now?
Yeah, we can hear you just fine.
Yeah, I mean that was the question. So, what's your experience of your doctors, your experts using the hydroxychloroquine in your patients? So, concerning the efficacy and also the side effects.
All right. Well, let's open the floor for our Chinese guests. Would anyone like to take this question?
Okay. Thank you very much. And about the use of the hydroxychloroquine is a long story for us. After the outbreak of COVID-19 in Wuhan province, some doctor in Wuhan Renmin Hospital analyzed the clinical features in 178 patients with COVID-19, and they found that there has no SLE patient in this group. And from the clinical follow-up, 8 SLE patients in dermatological department of the same hospital has no infection with coronavirus. It means 8 patients, but no one has infected with coronavirus. So the doctors assume that the hydroxychloroquine may be the effective drug to anti-coronavirus 19. And in the follow studies, some doctor found that the drug could have the in vitro activity against SARS-CoV-2 and SARS-CoV-virus and SARS-CoV-2 and also other coronavirus. So in the 6th version of the guideline on the diagnosis and treatment of patients with COVID-19 in China, they recommended that we could try to use the chloroquine for the antivirus treatment. So we use the hydroxychloroquine 200 milligram twice a day to treat the severe COVID-19 patients, and the total course is 7 to 10 days. We found that this drug has less side effect than chloroquine, and most people shows no side effect, just as the same observation of yours. And the mean side effect is QT prolongation and the gastrointestinal discomfort. And the symptoms could be improvement after the drug withdrawal. But what we should pay attention is nowadays some articles showed that this drug, including the chloroquine and hydroxychloroquine, has no effect for the severe patient according to the intubation period or the death rate. And the doctors in our country also find that the use of hydroxychloroquine did not significantly increase the negative rate of the nucleic acid in patients with mild to moderate COVID-19 patient. So the effect of chloroquine or hydrochloroquine need more evidence-based medical evidence. So thank you.
Yeah. Thank you very much for that answer. And so, shall we proceed with another question, or you will?
Please do. You have the floor.
Yeah. Since we are talking about the current therapy, so was the most effective therapy you used against the virus? Did you have any experience using the antiviral drugs for the treatment of COVID-19 patients?
It's my pleasure to take this meeting about the antivirus drugs, because according to the treatment protocol or the guideline of our country, actually the guideline ever recommended several antivirus drugs we can use in the clinical practice. Actually, we did use these drugs in our clinical practice. We ever used several antiviral drugs, including what we're talking about, the hydroxy chloroquine, and also the alpha interferon, and ribavirin, and Abidor, some kind of drugs. But so far, according to our experience, actually we did not find none of them had better effect than the others. I think maybe because what we treat the patients, half of them are the severe patients. Maybe it's because some of the drugs are effective in the in vitro studies. So maybe if these drugs used in the early stage of patients, maybe they are useful. But for the severe patients, we don't see a significant effect of the antiviral effect. Also, what we were using, according to the protocol or the guideline, we use only 2 of the drugs, no more than 3 or more. So maybe that's the reason, because I noticed there is a research, there are a paper from the Hong Kong. They said in their study they used 3 kinds of antiviral drugs. It seems it's more effective than the use the anti-drugs only. Maybe we can use the combination is more effective, but we need more study to see that. So far, I think there's no one antiviral drugs has significant effect than the others. So at present now, because we do not have drugs which can have a magic effect against the virus. So we think the best strategy to treat the patient maybe is to give the patient strong and enough support. Like we need support the patients with sufficient nutrition. We need control the patient's blood glucose, control their blood pressure, because we know some severe patients, they often have some chronic disease like hypertension and diabetes. We need to control all of the complications. We need to take care of their liver function, renal function, and also we need to pay attention to their mental disorder. And if we do that, we can help the patients to get the ability to against the virus by themselves. And that's what we did in Wuhan. And I think that helped us to reduce the mortality rate dramatically. So that's what we are, our experience about the antivirus drugs. Thank you.
Thank you very much for your answer. So just a quick answer, if it's possible, to give us an overview. Do you have any experience using the favipiravir, the drug produced in China? In Japan. So it's been launched by Fuji Pharmaceuticals, and I can see that they are ready to spread and to distribute the drug throughout other countries. More than 44 countries around the globe are now ready to use the favipiravir for experience to get experience for treating the patients with the COVID-19. Did you have any experience using the favipiravir or not?
What kind of drugs?
The drug is favipiravir.
Perhaps you could, someone could type that into the chat box for the doctors to see. Would that be convenient? Dr. Scribbage, would you be able to write that into, I don't know if you have access to a keyboard, to type, or just to type the name of that drug in, and then our Chinese doctors can see the name of that written down.
Okay, thank you.
Thank you. Dr. Hall, can you see that?
Yes.
Favipiravir.
法匹拉维。
哦，是那个就抗艾滋那个是吧？张毅，你知道不是这个收听？我们没有这个哦。
Sorry.
Oh,
it's a drug
yes.
to anti the Ebola virus. We can't get this kind of drug, so and it's not in the guidelines in our country, so we don't have the experience of the use of this drug.
But we have a colleague who are involved in the RCT. They are using the remdesivir or these drugs. I think we know that there are some results from the RCT from America. They have some good news for these drugs. But for the study held in our country, our colleagues didn't find the effect of this drug to the virus. That's maybe they involved in different patients, because in our country, most of the patients, they are severe patients. So that's what we learned about these drugs.
Okay, thank you. Thank you very much.
All right, should we take a question from Ms. Todorovic?
Hello, everyone. Can you hear me?
Yes, we can all hear you fine.
Thank you very much for organizing this video conference. I would like to ask you to tell us more about your experience with asymptomatic patients and where and how you treat asymptomatic patients. Are you providing treatment for those patients in hospital or in their houses?
Yeah, I think this is my question, right? You talk about the asymptomatic patient, right? Can you hear me?
Yes, yes.
Oh, okay, all right. Just wait a minute. You know, in our country, to ensure the safety of the asymptomatic patient and their close contacts, according to our national guideline, this patient do not need to be quarantined in a designated place. It may be maybe a hotel or maybe a temporary hospital, but not in their houses. They will be quarantined for 2 weeks. And but all of these symptomatic patients do not need to be treated. They only need to be observe the clinical symptoms. If they have the clinical symptoms, they will be sent to a designated hospital for the treatment. And if they do not show any symptoms in the 2 weeks guarantee, and they will have 2 times of PCR test for the coronavirus 2, and in different days. If all the tests are negative, the quarantine will be stopped. Otherwise, the quarantine need to be continued until a negative PCR test. This is my question. This is my answer.
Okay, thank you. I would like also to ask you what Chinese authorities have done to track people's health status, especially with artificial intelligence.
这可能是其他人的问题，我觉得。
Now, I think this is my question. Now, our government have a method. You know, all the residents they are asked to log on online program, which is we can find that on the app we call WeChat or Alipay. This app are widely used in China, so people can find the program on that app, and then when they register on that, and when they input their ID number, and they will get a health QR code, and that QR code is belong to them, and that code will show 3 colors: red, yellow, and red. The red means they are at very low risk to have infected the virus, and they are freely to walk around, and they can go outside and go somewhere else. And if the color is yellow or red, that means the risk of being infected is going high, and that means they need to be isolated. And this health QR code help us to find out to which people are healthy, are at low risk of the infection, and they can I think this is based on the big data, and you know, from the big data, maybe there are many multiple data resource. They can help to judge to the people if they have the situation of the health. So this helps a lot, because when the situation about the infection has become improved, you know, the people need to go outside, need to go to work, and this health QR code can help us to identify which people can go to work and go outside, and which kind of people need to stay at home. Thank you.
Thank you very much. I would like also to ask you what China is doing right now to prevent cross-border infection.
Okay, about the cross-border infection, all the people who want to go inside or go out of outside our country, they should be required to declare the health report to the customs and the quarantine department, and also they should cooperate with the quarantine worker of body temperature monitoring, and the medical inspection and medical investigation. According to the new regulation, the intern personnel need to fill in the declaration card of intern health situation. Then they should accept the inspect of the custom and quarantine department and measure the body temperature and health quarantine on the carry-on items also. Only those who pass the quarantine can enter the country. And if there are someone be recognized as the infected or a suspect patient, they should be isolated by the health and the quarantine department. And the epidemic investigation should be carried out immediately. According to the for the people who want to go abroad, they have to they must go to the health and quarantine department for the health inspection and get the international travel health certification. They can only leave the country after being inspected by the customs and the quarantine department. That's all.
All right, well, Ms. Todorovic, we'll come back to you later for some more questions, but let's return to our panel in Bosnia and Herzegovina. Do our doctors there have any questions for our Chinese doctors to add?
Good evening. Good evening. Sorry. Good evening. Thank you very much for this video conference. Thank you so much for help, for support, and for sharing your experience with us. My question is about corticosteroid therapy in severe forms of acute respiratory failure in COVID-19 patients. In our hospital in intensive care, we used to give our patients methylprednisolone 1 milligrams per kilo per day. We give them for 7 days, for a period of 7 days, and we think it may be helpful in severe forms of this disease. I want to ask you about your experience with it. When to give steroids to your patients, which patient will benefit, and which dose and how long? Thank you.
Okay, thank you for the question about the glucocorticoid treatment for the COVID-19 patients. And the clinical evidence does not support that the corticosteroid treatment for the mild patients. So we don't recommend it to use glucocorticoids to the mild or moderate patients. But according to our experience, the use of glucocorticoids for severe patients are effective just as you. And the most important index is SaO2 below 39% when the patient without oxygen. And we usually use the prednisone 1 to 2 milligram per day per kilogram, and the total cost is about 7 days too. When we use the glucocorticoids, we should pay attention to the side effect. For example, the fungal infection. And the indicators that we should pay attention to the patients is as follows. One is the oxygenation index, and the third one is the image of the patient, mostly the CT scan. And we should also pay attention to the inflammatory reaction. For example, if whether the patient has fever or whether the interleukin-6 elevated.
Thank you very much. we think similar, I think. So it's good. We also watch for some side effects like secondary superinfection, bacterial or fungal, like impaired glucose and something like that. It's similar. So my second question is about nitric oxide. We don't have so much experience with it, and I want to hear your experience or your thinking about therapy with nitric oxide in severe forms of respiratory failure. Thank you.
Which of our Chinese doctors can take this?
We have not used the natural oxygen. But you can try use it. Maybe have a surprise.
Dr. Wang, do you have something?
Okay.
Is there something to add?
It's a novel thing, so I just want to hear your experience or your thinking about it. Thank you.
So if I may propose Dr. Kovacevic, who is the head of the ICU department here, to raise a question. Okay?
Please do.
Okay. Hello to everyone. I'm very glad to be a part of this conversation and discussion about the treatment of the patients who are infected with COVID-19. As I am pulmonary and critical care physician, I'm interested in some part of treatment with critical care patients. You know, my first question is, what was and what is your experience with extracorporeal membrane oxygenation in the treatment of severe ARDS patient treated infected with COVID-19? So, do you have experience, and what was the indication? When did you start extracorporeal membrane oxygenation for the patients? So, and your experience, of course.
So, thank you, doctor. Thank you for your question. And you know, in Wuhan, for the patient with COVID-19, the patient who needs the ECMO therapy or ECMO support, most of them will send to the other two designated hospitals for the support of ECMO. So although our ECMO team is the center of the International ISO organization, and we have experience in the ECMO support for the influenza and for the other respiratory infections, but until now we don't have the experience on the ECMO procedures in the COVID-19 critical ill patients. But according to the communication with the other medical team, the VV ECMO will be used for the COVID-19 patients who have tried the other methods, but the patient saturation and patient hypoxic state cannot be improved. So we believe the ECMO support plays really an effective breathing support, and it will buy time for the repair of the patient lung, and maybe for some patients it will be the last chance to save their lives. But however, I have to say the technical operation is relatively complicated, and the procedure needs a lot of human resources, require a lot of human resources and medical resources. So and also the daily management is difficult, and it also have many complications. So I think during the COVID-19 pandemic all over the world, the medical resources and the healthcare workers' resources are limited. I think we should measure the benefit and risks properly based on the experience, the ability, and the medical care resources of the local medical team to before the support of ECMO, and then decided to use the ECMO support. That's my answer. Thank you.
Thank you very much for your answer. My second question is related to the prone position. So, did you perform proning for the critically ill patients who are with severe ARDS? And how often did you use that proning position for the patients? Thank you.
Hi, this is Yin Juan. I take this question. I'd like to share with you some of our experience in doing the prone position. Yes, indeed, we had difficulties in doing the prone positions due to the lack of nursing staff. But for the benefit of the patients, during our time in Wuhan with COVID-19 patients, we did conduct prone procedures on quite a few cases, both on mechanical ventilated patients and the non-mechanical ventilated patients. I should say most of the time we got positive response, such as improved oxygenation, more stable breathing, vital signs, or decreased oxygen demanding, or decreased agitation levels. And some COVID-19 studies even have shown the decreased mortality as well. When we do the prone position, the utmost care is to make sure the safety of the patients and the staff as well. Concerning the patient's safety, it is crucial to avoid ventilator disconnection, the tubing stuff, skin injuries like pressure injury and facial edema, and sometimes, deteriorating vital sign like immediate reduction in oxygen saturation and arrhythmias. In terms of the safety of staff, the most important thing is to prevent their exposure to virus. This includes proper equipment of PPE, keeping distance from possible spitting of airway secretion. So once we get order of prone ventilation from our physicians, we nurses first check out if there is any contraindications, such as unstable blood pressure, facial or pelvic fracture, spinal injury, or acute bleeding, etc. Secondly, we have to have 4 to 6 staff at hand, at least 4, 2 at each side of the bed. Everybody should be very clear about his or her responsibility, such as looking after, the tubing position of each part of the body, monitoring the vital signs, etc. In terms of the treatment time, it varies from 4 hours to 8 hours, or even 12 hours, or sometimes even longer. The other thing I want to mention is that the patient should be well sedated if they are on mechanical ventilation. Otherwise it is too hard for our nurses and not good for the patients either. So that's my answer.
Okay, thank you very much for your answer.
Thank you very much.
Yeah.
Well, I just want to repeat Dr. Jandrich's question earlier about the use of nitric oxide. And I do know Director Fei did say that our doctors didn't try this there, but does anyone have any perhaps thoughts to share on this, which I believe Dr. Jandrich was asking about? So nothing on the use of nitric oxide use. All right then. Okay, well, let's move on. Let's go back to.
I'd say
Dr. Wang?
It is not ordinary or routine therapy in China. because the nitric oxide is relatively difficult to get. So we don't use this kind of therapy in our COVID-19 patients. So we have no experience. Thank you.
Okay. I want to ask one more question, if I can. Okay.
Please go ahead.
It's about thromboprophylaxis in COVID-19 patients. My question is, do you use prophylactic dose or therapeutic dose in these patients? So is it prophylactic dose, for example, with enoxaparin, or is it therapeutic dose? Because in different centers, someone prefer prophylactic dose, someone prefer therapeutic dose because of higher chance for thromboembolic complications in these kind of patients. Thank you.
So, do you mean to use the low molecular heparin to prevent the stormburst? Did I get you? This is the question.
Yes. Yes.
Yeah, this is really good question. I have to say, in most patients with COVID-19, in our department, the admitted patients are severe patients. We have 4 categories: mild, moderate, severe, and critically ill. So the patients hospitalized in our department, patients are severe and critically ill patients, and most of them will stay on the bed, and they won't walk or get off the bed. So we think they are at high risk of VTE. So generally, most of the patients will receive the low molecular weight heparin for prevention of the VTE. We do not use a treat dose, just a prevention dose, I have to say. If the patient was, have the symptoms of VTE or the other kind of stormburst, they would, if they have been diagnosed, we will give them a therapy dose. Yeah, that's our experience. And I also say there is a publication, I don't remember, at the Lancet or New England Journal of Medicine, I'm not sure. There are evidence from the just wait a minute, autopsy of the Chinese patients, and they found the small or little stormburst in the lung vascular. They found that. So I believe if the patient do not have the contraindications, we should use the low molecular weight heparin in the severe or critically ill patients. Thank you.
Thank you very much.
Could I share some experience? In our opinion, we think that the anticoagulation treatment is very important for COVID-19 patients, especially severe patients. According to our observation, we found the D-dimer of the severe COVID-19 patients elevated. So I think it's important for the patient to use the low molecular weight heparin. Thank you.
I have additional question related to use the plasma of the convalescent patient. So what's your experience using the plasma of convalescent patient?
Hi, Dr. Zhang Yi, could you answer the question? 这个恢复疾病的血浆。
血浆是。
张一，
掉线了吗？
You know, I have to say, there are several patients. You know, the number is not large. Maybe several patients received the you know plasma from the recovered patient, and most of the patients are are severely ill, and they have the many organ dysfunction of failure, and the mortality is very high. So even they got the plasma from the recovered patient, and some patient cannot improve. Some of the patients, and maybe some patients may improve, but I'm not sure it is effect of the plasma. Maybe because of the other reasons. So this is my personal opinion, and maybe the other professor, the other doctors can add some comment on the use of the plasma. Dr. Zhang. Zhang Yi.
Dr. Zhang, are you back with us? Dr. Zhang, can you hear us? All right, once she's back online, let's try and ask her to see if she has anything to add on that question. If none of the other doctors, do any of the other Qilu hospital doctors have anything to add on this, on the plasma treatment?
Can you hear me?
Yes.
Yeah.
Okay.
Welcome back, Dr. Zhang.
Yeah, sorry about the internet. And according to our guidelines for the treatment of COVID-19 patients, the convalescent plasma treatment is recommended to the patients, especially the severe patients and the patients, the disease that progress fastly. So if the patient under the antivirus treatment and other treatment, the index didn't show good, you should use the convalescent plasma treatment.
Okay. Thank you. Thank you very much for your answers. Thank you.
Thank you.
Should we go back to Ms. Todorovic? You have some more questions, I believe.
Hello, can you hear me?
Yes, we can.
I would like to ask what kind of measures are you taking to prevent medical staff to not get infected?
防护一般分为3个等级，我们应该根据不同的这个岗位，进行做不同的防护的等级。
So we generally have 3 different standards for the PPEs, and according to the different positions of the doctors and medics and nurses, we have conducted and provided the PPEs at different positions.
因为如果防护过度的话，一个是可能会造成防护物资的浪费，再一个可能给病人一个不是太舒服的就医的体验。
But if we consider the whole medical environment, if the medical workers are overprotected, it might be causing a waste of the medical resources. Apart from that, it also might creating a very anxious image for the patient, creating their anxieties and also make them depressed while they are seeing the medical workers.
所以适当的防护是最好的措施。
So that is the reason why I believe appropriate PPE is the best.
Thank you.
Thank you for your answer. I would like also to ask which type of PPE you recommend that people still should wear in public spaces. Is that mask and gloves or only masks, for example?
您好，现在您推荐在这个大家在公共场合上应该采取什么样的一个防护措施？是现在还需要戴口罩，还是说大家戴口罩还要戴这个防护手套？您觉得说现在在这样一个公共环境下，在我国现在的这样一个时期，应该采取什么样的这个 PPE？ 谢谢。
Okay, I take this one. To our understanding, generally speaking, for the public not seen working in the healthcare settings or having close contact with the confirmed cases, there is not much virus. If we walk by or play or work in open areas, as long as we keep, 6 distance from each other, we are safe. This means we can take off our masks. But however, if we work or stay indoors with others, especially relatively crowded public places like canteen shops, dormitories, conference rooms, we need to wear, the surgical mask. Surgical mask is good enough. There is no need for people to, other than the healthcare workers, to wear high levels of PPE, like gowns, gloves, or N95 mask even. So I wish I, answer your question.
Yes, thank you very much. Thank you very much to all of you.
Yeah.
All right, well, we do have a question now that I'd like to pose to all our doctors and specialists here from one of our viewers. Let's just get the question up on the screen in a moment. This question comes from Joe Nabsky. How to strengthen the immunity of an old age? I need tips for my granny. So I guess as the elderly are one of the high at-risk, most vulnerable groups here, this question is probably quite pressing. So any of our doctors, please jump in anytime, anyone. I could give some tips. Any of our doctors from Qilu Hospital can maybe answer this question on. Yeah, please do. Thank you.
Yeah, for old people, they are a high risk of group, may have a danger, can be infected by the virus because we take care of a lot of old people in our in the hospital, and I think for the old people, one is to help their immunity is they need to get a healthy lifestyle, like they need to eat well and do some exercise. That's very good for all the people, especially for the old people. And very importantly is we know the old people they do have a high risk to get infected, and so it's maybe helpful they don't go some places very crowded. It's increase the risk to get infected. That's also very important. They maybe get more time staying at home or go someplace there are not so many people and maintain the distance with other people. That can help them to reduce the risk of infection. Also, the good habit of lifestyle is, I think, is very good for them. Like you need eat not so salty, eat vegetable, and not too much oil. I think that's maybe help them. The good lifestyle is very important for them.
Thank you very much, Dr. Ho.
And my question, my answer is, we have to confess the elderly have decreased immunity. We have to confess that. So, the best way to avoid infection is to have a social distance. This is very important. The second, my suggestion is to eat well. Eat well means you need to eat more, have more protein. Protein is very, very important because maybe there's a proportional of the elder patients have is malnourished. So to ensure the protein supply is very important for our immune system. So this is my two suggestions. Thank you.
Thank you for that, Dr. Wang. What about our Bosnian doctors? Is there anything you'd like to add on this particular question, or anything else? In fact, any other thing, any experience to share or questions?
No, that's more or less all we wanted to ask, and thank you very much for all answers we gave from your doctors.
All right, well, thank you. What about Ms. Todorovic? Is there anything else you'd like to ask or add?
I would like to add that also, beside boosting our immune system with healthy food and good sport life, we should also think about our mental health and try to stay positive as much as possible. And people who are staying inside, who are elderly, they at least they should just try to stay in contact with their family members through different online platforms and just to stay isolated.
Thank you very much. And just finally, just go back to all our Qilu hospital doctors. Does anyone have anything further that they'd like to share? Not necessarily related to this question of immunity for old age, but just in your experience of treating COVID patients. Any other words that you'd like to share with our Bosnian doctors?
Yeah, so talk about the steroid. I have some opinions to share. And, I'm a doctor from the critical care department. I'm an intensivist. And I believe maybe the doctors from different background, maybe from the critical care or from the respiratory or the other, other major, they will have different opinions in the use of steroid. And as I know, in the international guidelines, according to the international guidelines of the field of critical care, there's no evidence for the use of glucocorticoid for the patient. That means there's no evidence that the use of glucocorticoid will improve the mortality, will decrease mortality of the patient, COVID-19 patient, or the other kind of ARDS patients. But I think there are two kind of situations we need to consider the use of steroid. The first is maybe the cytokine storm syndrome. There's a number of patients who is getting worse, who is getting deteriorated, and with decreased oxygenation, and with developing imaging X-ray or CT scan, and especially the cytokine levels will remarkably increased. For this kind of patient, I think they may be benefit from the use of steroid. And the other kind of the other indications for the steroid may be, the severe ARDS with very, very low oxygenation index, and also patient with with refractory septic shock. We could try the use of steroid, but I believe we need more evidence to prove the effect on the mortality of steroid usage. Thank you.
Thank you so much, Dr. Wang. All right, if no one has anything else to add. Yes, go ahead, Mr. Scribbage.
No, that's all. I just wanted to say thank you. Thank you for this nice answer at the end. Thank you. It's very useful.
All right, well, let's wrap up our discussion here. I just want to say thank you once again to all of you for taking the time out to attend this session with us and for sharing all your experiences and thoughts. And it really is very informative, I hope. So thank you once again, and thank you to our interpreter as well. As always, a lot of really important information and experience shared from the front lines on treating patients with COVID-19. And also we heard a lot of public health matters here as well. So we hope, of course, this will be useful to any medics who are still out there fighting and treating patients with COVID-19. And thank you for your hard work as well. So we'll wrap up our program here. I'm Jiao Yang. Thanks so much for watching COVID-19 Frontline. And as always, we remind you to please keep an eye out for when the next session will be. Bye-bye.